Have you ever wondered how modern medicine is fighting against acute lymphoblastic leukemia, or ALL for short? One of the warriors in this battle is a medication called Blinatumomab. This medication is a bispecific monoclonal antibody, a type of targeted therapy that utilizes our body's immune system to fight against cancer. Now, how does Blinatumomab work? It's designed to bind simultaneously to two types of proteins. First, it binds to CD19 proteins found on the surface of B-cell lymphoblasts, the cancer cells in all. Second, it binds to CD3 proteins found on the surface of cytotoxic T cells, the soldiers of our immune system. When Blinatumomab binds to these two proteins, it brings the cancer cells and T cells into close proximity. This intimate contact enables the T cells to recognize the cancer cells as foreign invaders. Once recognized, the T cells can then attack and destroy the cancer cells. This unique mechanism of action allows Blinatumomab to act as a bridge, connecting the cancer cells and the T cells and facilitating a targeted attack on the cancer cells. Now, you might be wondering, when is Blinatumomab used? Blinatumomab has been approved for specific cancer indications. It's used in treating relapsed or refractory B-cell precursor acute lymphoblastic leukemia, also known as ALL, in both adults and children. This essentially means it's used when the disease has come back or hasn't responded to other treatments. Additionally, it's also used for minimal residual disease, or MRD-positive B-cell precursor ALL. This refers to situations where small amounts of cancer cells are left after treatment, which can be detected using sensitive testing methods. Now let's talk about how successful Blinatumomab has been in treating cancer. Clinical trials have shown promising results. In cases of relapsed or refractory ALL, Blinatumomab has demonstrated complete remission rates of around 40 to 50% in various studies. That's quite impressive, considering these are cases where other treatments have failed or the disease has returned. For MRD-positive ALL, Blinatumomab has shown the ability to induce what we call MRD negativity. This means that after treatment with Blinatumomab, these sensitive tests can no longer detect cancer cells in the patient's body. This is a significant achievement, as it decreases the chance of the disease returning. While these results are promising, it's important to remember that Blinatumomab is not a cure for all, but rather a bridge to potentially curative stem cell transplantation. This means it's used to reduce the disease to a point where a stem cell transplant, which offers the best chance for long-term remission or cure, can be performed on eligible patients. So, where in the world is Blinatumomab being used, you may ask? Well, this remarkable medication has been approved in several countries and its use is spreading. The United States was the pioneer, giving its nod of approval in 2014. Following closely behind, the European Union gave their approval a year later in 2015. Canada, not wanting to be left behind in this medical revolution, approved Blinatumomab in 2018. That same year, Australia also joined the Blinatumomab League. Japan, known for its meticulous approach to medical treatments, also gave its approval in 2019. Beyond these countries, Blinatumomab is being used in several other nations across the globe. The global acceptance of Blinatumomab is a testament to its effectiveness in treating acute lymphoblastic leukemia, especially in cases where the disease is either relapsed or refractory, and where minimal residual disease is present. It's important to remember, though, that Blinatumomab is not a cure. It's a bridging therapy, a stepping stone towards stem cell transplantation, which offers the best chance for long-term remission or cure in eligible patients. To sum up, Blinatumomab is a significant advancement in the treatment of certain forms of ALL, providing a targeted immunotherapy approach with manageable side effects compared to traditional chemotherapy regimens. In the fight against ALL, Blinatumomab is certainly a weapon worth knowing about.